Human immunodeficiency virus, HIV, is a retrovirus that depresses the immune system. Usually people with HIV are more susceptible to infections that are normally controlled through immune responses. The transmission of HIV is through contact with infected blood, semen, vaginal secretions, or breast milk. It's not spread casually, which would be hugging, dry kissing, shaking hands, sharing eating utensils, using toilet seats, or casual encounters. It is also not spread by tears, saliva, urine, emesis, sputum, feces, sweat, respiratory droplets, or enteric routes. The pathophysiology is it's an RNA virus, which is a retrovirus, because they replicate in a backwards manner, going from RNA to DNA. It cannot replicate unless inside a living cell. CD4 cells, which are a type of lymphocyte, is the target cell for HIV. HIV enters the CD4 T cell by binding to protein receptors on the outside of the cell. This is known as fusion. Once HIV is attached and fused to the CD4 cell, HIV RNA enters the cell, which triggers the release of reverse transcriptase, which is an enzyme that transforms HIV RNA into a single strand of DNA. This strand copies itself and becomes a double-stranded viral DNA. Integrase, which is another enzyme, allows the newly formed double-stranded DNA to integrate itself into the host genetic structures, which has two consequences. One, because all genetic material is replicated during cell division, all daughter cells are also infected. And two, viral DNA is the genome directs the cell to make new HIV. Protease cleaves the newly formed strands of HIV genetic material into smaller pieces. New HIV virions are then formed and released. The CD4 T cell is then destroyed after the HIV virions are released. HIV destroys about 1 billion CD4 T cells every day, and for many years the body can produce new CD4 T cells to replace the destroyed ones, but over time the ability of HIV to destroy CD4 T cells exceeds the body's ability to replace the cells. This impairs the immune function of the host. 500 CD4 T cells or more is a healthy immune system, so immune problems begin to occur when the count drops below 500 and severe problems develop with fewer than 200. With HIV, a point is eventually reached where so many CD4 T cells have been destroyed that not enough are left to regulate immune responses. This allows opportunistic diseases, which are infections and cancers that occur in immunosuppressed patients, to develop. Their main cause of disease, disability, and death in patients with HIV. Clinical manifestations and complications. Remember that disease progression is highly individualized. Treatment can significantly alter this pattern, and when an individual's prognosis is unpredictable. So HIV has an acute infection, a chronic infection, which can be asymptomatic or symptomatic. An acute infection usually develops 2 to 3 weeks after someone becomes newly infected with HIV. Individuals typically experience acute HIV infection, which is a period when people can have a mononucleosis-like syndrome of fever, swollen lymph nodes, sore throat, headache, malaise, nausea, muscle and joint pain, diarrhea, and/or diffuse rash. Some people develop neurologic complications, which would be aseptic meningitis, peripheral neuropathy, facial palsy, or Guillain-Barré syndrome. The amount of HIV circulating in the blood is very high, and CD4 T cell count falls temporarily but quickly returns to baseline. Some healthcare providers mistake this stage for a bad case of the flu. People are most infectious during this stage because of the high amounts of circulating HIV. Chronic infection can be asymptomatic or symptomatic. During the first several years, people are asymptomatic and have no symptoms or relatively limited signs of infection. During this time, infected people continue their usual activity, which may include high-risk sexual and drug-abusing behaviors. This is a major public health problem. Infected individuals can still transmit HIV to others even though they have no symptoms. Symptomatic develops as the CD4 T cells count declines closer to 200 and the viral load increases. HIV advances to a more active stage. Persistent fever, frequent night sweats, chronic diarrhea, recurrent headaches, severe fatigue may develop. Thrush is also a common infection in HIV-infected people. Other infections can include shingles, persistent vaginal candida infections, outbreaks of oral or genital herpes, bacterial infections, and Kaposi sarcoma. Oral leukoplakia causes painless white raised lesions on the lateral aspect of the tongue and is another indicator of disease progression. Acquired immunodeficiency syndrome, AIDS, is made when an HIV-infected patient meets criteria established by the CDC when immune system becomes severely compromised. Many infections, malignancies, wasting, and HIV-related cognitive changes can occur in patients with immune impairment. Diagnostic studies for HIV infection can be made by testing for HIV antibodies or antigens in the blood. Typically, it takes several weeks after initial infection before evidence of HIV can be detected on a screening test. This delay is known as the window period. Screening tests can be performed using blood or saliva. Combination antibody and antigen tests, which are fourth-generation tests, are able to detect HIV earlier within 3 weeks following infection. Rapid HIV antibody testing results are highly accurate and are typically available within 20 minutes. Laboratory studies in HIV infections, which are used for monitoring HIV progression. The lower the viral load, the less active the disease. The goal treatment is to suppress the viral load to the lowest possible level, which is below the level of detection on a commercial assay. Does not mean that the virus has been eliminated from the body or that the individual can no longer transmit HIV, but it refers to the fact that the amount of circulating HIV in the blood is below the level of detection of the test. Abnormal blood test results are common in HIV infection and may be caused by opportunistic diseases or complications of therapy. Decreased white blood cells, low platelet counts, anemia, altered liver function are very common. Early identification of co-infection with hepatitis B or hepatitis C is extremely important because these infections have a more serious course in patients with HIV and may ultimately limit options for ART, which suppresses or stops retrovirus, and can cause liver-related morbidity and mortality. Resistance tests can determine if a patient's HIV is resistant to drugs used for ART. These tests are similar to culture and sensitivity testing for an antibiotic selection.
The goal of drug therapy is to decrease viral load, to maintain or increase CD4 T cell count, to prevent HIV-related symptoms and opportunistic diseases, to delay disease progression, and to prevent transmission. Antiretroviral therapy is a combination of drugs from several different classes that inhibit viral replication. HIV cannot be cured, but ART can delay disease progression, because when the virus is slowed down, so is the disease process. The major problem with ART is that resistance occurs more often when drugs are used inadequately or taken alone, so it is very important to use 3 or more drugs together, and it is also important for the patient to stick to their medication regimen. Here's a list of drugs that are used in antiretroviral therapy: entry inhibitors, nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, and nucleotide reverse transcriptase inhibitors. Again, it is very important to use at least 3 different drugs from at least 2 different groups in order for ART to be effective. Patient or caregiver teaching is very important to decrease the risk of developing resistance. A patient undergoing ART should discuss their options with their healthcare provider to determine the best regimen for them. The patient should know the drugs that they are taking and how to take them. Some drugs have to be taken with food on an empty stomach, and some cannot be taken together. If the patient does not understand, they should ask the nurse to write the instructions clearly for them. The patient should take the full dose of medication as prescribed and take it on schedule. If the patient cannot take the drug because of a side effect or other problems, they should report it to the healthcare provider immediately. The patient should not quit taking one drug while continuing the others. If the patient cannot tolerate one of the drugs, they should talk to the healthcare provider, who will recommend a way to deal with the side effects or a new set of drugs. Many ART drugs interact with other drugs, including a number of common drugs that can be purchased without a prescription, such as St. John's wort, antacids, and some proton pump inhibitors. Most healthcare providers do routine lab work every 3 to 6 months, whether the patient is taking ART agents or not. 2 to 4 weeks after the patient has started on drug therapy or has changed their drug therapy, the healthcare provider will test their viral load to determine how the drugs are working. An undetectable viral load means that the amount of virus is extremely low and HIV cannot be found in the blood using current testing technology. It does not mean that the virus is gone, because the virus can be in lymph nodes and in organs that blood tests cannot detect. It also does not mean that the patient is no longer able to transmit HIV to others. The patient will still need to continue protecting all of their sexual and drug-using partners from HIV. Management of HIV is complicated by opportunistic diseases that can develop as the immune system deteriorates, such as yeast infections, mycobacterium tuberculosis, hepatitis A or B. Although it is usually not possible to eradicate opportunistic diseases once they occur, prophylactic medications can significantly decrease morbidity and mortality rates. A number of opportunistic diseases associated with HIV can be delayed or prevented with adequate ART and vaccines, such as hepatitis B, the flu shot, or the pneumonia vaccine. Physical problems related to HIV or its treatment can interfere with the patient's ability to maintain a desired lifestyle. HIV-infected patients frequently experience anxiety, fear, and depression. They may also experience diarrhea, peripheral neuropathy, pain, nausea, vomiting, and fatigue. Nursing interventions for these symptoms are similar to what they would be for a patient who does not have HIV. For example, nursing management of diarrhea would include helping the patient collect specimens, recommending dietary changes, encouraging fluid and electrolyte replacement, and instructing the patient about skincare. Some HIV-infected patients, especially those who have been infected or on ART for a long time, may develop a set of metabolic disorders. This can include lipodystrophy, which is a change in the body shape caused by a redistribution of fat in the abdomen, upper back, and breast, along with fat loss in the arms, legs, and face. They may experience hyperlipidemia, insulin resistance, hyperglycemia, bone disease, lactic acidosis, renal disease, and cardiovascular disease. Some signs and symptoms associated with HIV-infected patients that need to be reported immediately include any changes in level of consciousness, a headache accompanied by nausea and vomiting, vision changes, persistent shortness of breath related to activity and not relieved by a short rest period, nausea and vomiting accompanied by abdominal pain, vomiting blood, dehydration, unable to eat or drink because of nausea, diarrhea, or mouth lesions, severe diarrhea or vomiting, dizziness when standing, yellow discoloration of the skin, any bleeding from the rectum that is not related to hemorrhoids or trauma, for example, from anal sexual intercourse, pain in the flank with fever and inability to urinate for more than 6 hours, or blood in the urine. The fact that infected individuals can transmit HIV to others creates fear, which leads to stigma and discrimination in all facets of life. In the U.S., HIV-infected people have lost jobs, homes, and insurance. Although these forms of discrimination are prohibited by the American with Disabilities Acts, HIV-related stigma is a global problem that is often more severe for women. Discrimination can lead to social isolation, dependence, frustration, low self-image, loss of control, and economic pressures. As nurses, we can help stop the stigma by first off knowing the facts, educating patients as well as the public about HIV transmission and treatments. Try not to discriminate against HIV patients. Choose your words carefully when talking to the patient and the family about HIV. And most importantly, help the patient to focus on the positives. One very important scripture related to our topic is found in Romans chapter 2, verse 11. For there is no partiality with God. By keeping this scripture in mind while caring for patients with HIV, healthcare providers as well as nurses can help the patient to feel as equal as possible while promoting impartiality. Now is the time in our presentation where we ask you all a very, very important question. How important is it to adhere to medication regimen? You guessed it. It is very, very, very important.
To the individuals that are not known to be infected with HIV. Because HIV testing is voluntary, the nurse will not ask you if you want to be tested. That is definitely your choice. Though the actual testing is voluntary, as the nurse, we are to focus our questions on behaviors that put the patient at risk for HIV and other sexually transmitted and bloodborne infections. For the individual that has been diagnosed with HIV, upon assessment, you will be asked about your past history, which includes the route of your infection, your history of any other sexually transmitted infections, tuberculosis, any viral, fungal, and or bacterial infections that you may have had. You'll be asked to report any medications that you are taking, most specifically if you are taking immunosuppressive drugs, because taking these drugs along with having a immunodeficient virus will make you even more sick. Nurses, some important subjective data that you need to collect would be asking your patient to report changes in their weight, eating patterns if they're having nausea and vomiting, bleeding or ulcers around their lips, mouth, gums, tongue, or throat, if they're having any changes in their elimination patterns, activity levels, burning, lesions, or general pain on their genitalia or anus. Be sure to also address their stress levels, recent losses, coping patterns, and social withdrawals. Upon physical assessment, as the nurse, you will do a full head-to-toe assessment with emphasis on general appearance, eyes, skin, muscle tone and function, the GI system to assess mouth lesions, blisters, white patches, or candida and or hairy leukoplakia. You should also focus on neuroassessments to assess their coordination, memory, level of consciousness, and also assure that their behaviors are appropriate. HIV is preventable, and prevention remains a critical component to control this epidemic. And if primary prevention has failed, early intervention can be initiated. Safe sexual activities eliminate the risk of exposure to HIV. Abstaining from sexual activity is an effective way to accomplish this goal. But for those who cannot or do not wish to abstain, these individuals must limit sexual behaviors to activities in which the mouth, penis, vagina, or rectum does not come in contact with their partner's mouth, penis, vagina, or rectum. This eliminates contact with blood, semen, and vaginal secretions. Safe activities include masturbation, mutual masturbation, or a hand job, and other activities that meet the no contact requirements. Barriers should always be used when engaging in assertive sexual activities, which include oral, vaginal, and anal. This goes for all individuals, HIV infected or not. The most common barrier is the male condom, but also female condoms are available. These can be used during oral, vaginal, and anal sex. Squares of latex or dental dams can also be used during oral sex. Related to drug use, basic risk reduction rules are 1. Do not use drugs. 2. If you do use drugs, do not share equipment. And 3. Do not have sexual intercourse when under the influence of any drug, including alcohol, that impairs decision making. The risk of HIV for these individuals can be eliminated if they do not share equipment. Includes needles, syringes, cookers, cotton, and rinse water. Equipment used to snort or smoke drugs can also be contaminated with blood and should not be shared. Some companies have needle and syringe exchange programs, also known as NSEPs, provide sterile equipment in exchange for used equipment. Opposition to these programs is related to the fear that access to injecting supplies will increase drug use. However, studies have shown that in communities with NSEPs, drug use does not increase. Rates of HIV and other bloodborne infections are controlled, and an overall cost-benefit results. As far as perinatal transmission, the best way to prevent HIV infection in infants is to prevent HIV infection in women. Women who are already infected with HIV should be asked about their reproductive desires. Those who choose not to have children need to have family planning methods discussed in detail. Should they become pregnant, abortion should be discussed in conjunction with the possibility that the pregnancy is maintained and using ART to decrease the transmission of HIV to the baby. Now, as far as health promotion, number 1 would be to prevent HIV infection. These interventions include education, including knowledge, attitudes, and behaviors with emphasis on risk reduction to general population, pregnant women, and individual patients. Empower your patients to take control of prevention measures. Number 2 of health promotion would be to detect HIV early. Interventions include providing HIV antibody or antigen testing with appropriate counseling. As far as acute care, number 1 would be to promote health and limit disability. Teach regarding HIV, options of care, signs and symptoms to report, develop resources for legal need related to discrimination prevention, wills and advance directives, and child care wishes. Number 2 would be to manage problems caused by HIV infection. As nurses, we must ensure that our patients are adhering to an effective ART regimen and, if appropriate, taking prophylactic medications for opportunistic infections and decreasing the chances of acute exacerbations. An estimated 14% of people living with HIV in the United States are not aware that they are infected. Current guidelines recommend universal voluntary testing as part of the routine medical care, but the goal is to normalize the test. That being said, if you feel led, please go get tested for HIV today. But I can tell you that all day, so why not show you? And I say that because today, to be the change and the beginning of normalcy of HIV testing, I am getting tested for HIV right here before your eyes, so you can come along with me and see what it's like. Okay, Jesus. Leaving clinical, about to go get tested for HIV. I'm freezing, I'm about to die. I'm a die.
Destination is on your right.
Oh, I'm about to hit the curb, Jesus.
All right, y'all. I made it.
Maybe I need to get my keys out the car, so I won't be stuck here.
Don't we just love these type of camera angles?
So I'm in the room, y'all. Let me record.
Did this happen?
Yeah. So do y'all only do HIV testing here, or
Yeah,
what do you
it's
call
on the
it?
HIV testing here, but at the medical line we do syphilis testing.
Okay. So we doing the blood test or the mouth swab?
This blood test.
I do the bottom too. This one.
Just the top part. Thing.
It's like getting glucose stuff.
Mm-hmm.
Okay. So that's it.
Yeah. So this will be your first time?
Mm-hmm.
Okay.
So you gotta fill it all the way up to the...
Thank you.
It's that easy, y'all.
Only take 20 minutes.
Oh, what you just drop on there?
This will be the chase buffer. It helps read the antibodies in the blood.
Okay. Well, we just wait, huh? Do I wait in here or out there?
It'll be outside.
Okay. Can I get a Band-Aid? I know I keep bleeding. Thank you.
All right, Mr. McGloster, your results rate negative. There were no antibodies found in your blood. Okay.
Well, y'all go get tested for HIV. Takes 20 minutes. Pretty fast, pretty easy. I'm talking to the camera.
Can I give you your card?
No. Find out your status today. Yes, get tested. It's your health in your hands. Y'all, so it was that easy. So yeah, I hope y'all enjoyed our presentation. This was just a little extra piece. And now I need to go study my life away. Bye.